Perfect. All right. Hello and welcome everyone. This is a webinar for consumers on ground ambulance service organizations and the Balance Billing Protection Act. Just a couple of housekeeping items to get us started. So first, this session, as I stated earlier, is being recorded. We will be posting the recording of this webinar to the OIC website. We're hoping for the end of this week, but we don't have an exact date or time. The slides that we'll be using, that hopefully everyone can see right now, are also going to be available. There will be a 30-minute Q&A session at the end of the presentation. But if you have questions that do come up during the presentation, please feel free to put them in the Q&A box instead of the chat box. We will just get to them in order. Looks like it's open and oops, sorry. Looks like it is open and good to go. So the purpose of this webinar is the inclusion of ground ambulance service organizations. We also refer to them as GASOs in the Balance Billing Protection Act, which we also use the acronym BBPA. We'll be going over some of the background of balance billing, the Balance Billing Protection Act, how it looks in Washington, and why we are including ground ambulance service organizations now. My name is Sydney Regala, and I'm a health policy analyst here at the Office of the Insurance Commissioner, and I'm joined today by my colleagues Sharon Daniel and Jane Beyer. And before we get started, we wanted to do a land acknowledgement. Thank you for meeting today with the Washington State Office of the Insurance Commissioner. We start today's meeting with a land acknowledgement. We are meeting virtually and in person from Olympia and Tumwater on the traditional territories of the Coast Salish people, and specifically Nisqually and Squaxin Island peoples. Olympia and the South Puget Sound region are covered by the Treaty of Medicine Creek, signed under duress by the Coast Salish people in 1854. The OIC and Washington State employees respect these lands and tribal sovereignty. We acknowledge the tribal governments and the Coast Salish people living on and taking care of these lands. All right, and I am going to turn it over to Sharon to get us started. Sharon, you're on mute.
Sorry about that. Okay, so we're going to start today with a little background on what balance billing is. Sometimes it's referred to as surprise billing. Basically, every time you go see a doctor, you have certain payments that you have to make, certain out-of-pocket costs, such as a co-payment, co-insurance, or your deductible. All these costs together are known as cost shares or cost sharing. Providers and facilities, ground ambulance and air ambulance providers, they don't always have a contract with your plan. Those out-of-network providers will bill you the difference between what your plan agreed to pay and the full amount charged for the service. This is called balance billing. Surprise billing is basically an unexpected balance bill, and it mostly happens when you can't control who is involved in your care. Next slide. Most of the time, it happens when you have emergency services. For instance, the emergency physician is not in network with your plan, the anesthesiologist. A lot of those providers in emergency departments are out of network, as well as air and ground ambulance transportations. It also happens when you have scheduled procedures at an in-network facility, such as the surgeon or the anesthesiologist. Next slide. So here's a breakdown of what surprise billing looks like for ground ambulance transportation. So a ground ambulance takes you to the emergency room. The total cost of service is $1,000. So they bill the insurance company $1,000. The insurance company pays $200. Your cost shares is $300. That will leave a remaining balance bill of $500. Next slide. So balance billing, why does it matter? Well, there was a survey conducted by the Fair Health Prices of Washington And 31% of residents surveyed lived in a household with medical debt. Next slide. 63% said that they would struggle if they had to pay $500 or more in medical bills. In 2023, OIC sent a report to the legislator on ground ambulance balance billing, and the average price, the average balance bill for consumers for emergency ground ambulance transport is $500. This is in addition to what they normally pay. So that $500 in addition to the, say, $300 cost share. Okay, next slide. Okay, and I'm gonna pass it to Jane to talk about the BBPA and the No Surprises Act.
Hey, everybody. So the good news is that while Sharon just went over what balance billing is, Washington State started progressively banning balance billing starting in 2020 with the passage of the Balance Billing Protection Act. And the BBPA has been amended twice since then to expand billing protections. And then along with that, of course, Congress passed or banned balance billing starting in 2022 with passage of the No Surprises Act. Next slide. So historically, right, 2020, comprehensive balance billing prohibition is passed. And under the Federal No Surprises Act, because our law was so comprehensive, basically the Fed said, you get to keep a bunch of your law because it exceeds the minimums that are in federal law. And then during the 2022 session, the legislature passed a bill that basically aligned our state BBPA with the No Surprises Act, but we retained some key BBPA consumer protections. For example, consumers cannot be asked to waive their balance billing protections ever if they're enrolled in a health plan that is governed by the BBPA. And then most recently, what we'll be talking about more today is the passage of Senate Bill 5986, which prohibits balance billing for ground ambulance services, which is still the biggest hole in the No Surprises Act. And there's a federal advisory committee that came together with a number of recommendations to Congress. I don't think that report yet has been formally submitted to Congress, but hopefully Congress will take some action next year on the issue. In the meantime, we can at least help a bunch of folks in Washington State. And so one thing that I would want to note is that in addition to the balance billing prohibitions that were passed in 22 and 24, let's remember that emergency services were expanded to include behavioral health crisis services. And so along with that expansion of the concept of behavioral health crisis services coverage and balance billing protections under the law that passed this year that goes into effect January 1, we also required health insurers to cover transports, emergency transports to behavioral health crisis facilities. Next slide. Let's see, am I doing this one, Sydney? Okay, so Senate Bill 5986, again, applies to health plans issued or renewed on or after January 1 of 2025. And let's remember that it addresses balance billing prohibitions for covered emergency and non-emergency transports. Emergency transports are uniformly covered. There's some variation in the extent to which non-emergency transports might be covered by a health plan. And so if it's not a covered service, the consumer is still potentially subject to balance billing. And if somebody travels out of state, if they go to Idaho to vacation and they get an ambulance ride in Idaho, we don't have the ability to prohibit an Idaho ground ambulance company from balance billing somebody who lives in Washington State. And as indicated earlier, it requires coverage to transport to behavioral health crisis centers. And the health plans that it applies to are the fully insured individual, small group, and large group health plans that we, OIC, regulate. That's about 1.3 million people in Washington. And then all of Washington's public and school employee benefit programs. We should change student to school on this slide. And it also applies to self-funded group health plans that opt in to Washington state law. So there are currently about 450 self-funded health plans that cover cumulatively about 500,000 people. And so with we're having to go back to them and have them sort of reattest that they want to opt in, because we now have this expanded scope of services that are subject to balance billing protections. And we'll be working with self-funded health plans and with the Washington Health Alliance on that over the course of the next couple of months. Next slide. And I think it's back to you, Sharon.
Okay. So along with balanced billing protections, there are some other additional consumer protections to go along with the prohibition. One of them being that all out-of-network providers, they have to refund you if you happen to overpay them. Your cost shares will be applied to your deductible and out-of-pocket maximum. And any service that you receive from an out-of-network provider will be processed at the in-network rate. So that means that you'll only pay your in-network cost shares. It'll be as if you went to a regular in-network provider. Next slide. Okay, so health plans, they need to tell you who is in their network, what providers, facilities, air and ground ambulance providers. They have to have that information on their website or if you ask them. And providers, facilities, air and ground ambulance providers, they also have to tell you who they are in network with. And they need to give this information either on their website or if you ask them. Notice must be provided to consumers detailing your rights under the Balanced Billing Protection Act, and to let people know when you can and cannot be balance billed. This notice is now available on our website and is translated into the top 12 languages. Next slide. Okay. As Jean had mentioned previously, for health plans subject to the Balanced Billing Protection Act, consumers cannot be asked to waive their balanced billing protections. It's a little different for self-funded group health plans that have not opted in to the State Balanced Billing Protection Act. For those plans, the No Surprises Act governs. And for those situations and limited circumstances, consumer can be asked to waive their balance billing protections. This is only for certain non-emergency services provided at an in-network facility by certain providers. That would basically be, say, an out-of-network surgeon at an in-network facility. They can ask people to sign away their rights, but they can never require them to. We do encourage consumers to contact their employer or health plan for more information. Next slide. So if you think you've been wrongly billed, we encourage consumers to contact our office. You can also submit a complaint online. What we will do is we will look at the plan and the services and determine if it's subject to the Balanced Billing Protection Act. We will send the complaint to the provider, the facility, or the ground ambulance provider, and we'll ask them to cure the alleged violation. If OIC determines there is a pattern of unresolved violations, we will refer the provider, facility, or ground ambulance provider to the Department of Health or the disciplinary authority for investigation and possible enforcement. Next slide. All right, I will send it over to Sydney.
Thank you, Sharon. All right, everyone. So I am going to cover briefly another part of SSB 5986, and that is RCW 4849205. which was the requirement for locally set rate submission by local government entities. So this is basically just asking ground ambulance service organizations or their local governmental entities, so their fire district, their city councils, to share with the OIC the established and contracted rate for ground ambulance services. The first rate submissions were due on October 16th. We are currently going through those and getting them cleaned up. We are proposing that all future rates be updated by November 1 of each year, and they'll take effect January 1 of the following year. So the example would be rates would be due November 1, 2025, and all of those rates would take effect January 1, 2026. We also have an exception process that we are proposing, which would allow, in the case of ground ambulance service organizations that are experiencing financial hardships or fear that there's a threat to their financial viability, they would be able to submit outside of the window. They'd have to follow their local rate submission process. They'd have to demonstrate that there was a risk to their financial viability. They would need to give a 60-day window for those rates to take effect, and they would have 30 days to notify the Office of the Insurance Commissioner about those rates. This is all proposed because this is currently going through our rulemaking. I will go over where you can find information about our rulemaking for the implementation of SSB 5986 and the inclusion of ground ambulance services in the Balanced Billing Protection Act. But we are going to be releasing our CR 102 for comment in the next few days. And then there will be a public hearing on November 26th. That is the best place to submit any additional thoughts or comments on this rate submission process or any other parts of SSB 5986's implementation. The second part of the rate submission is that we will be making these rates publicly accessible. So that's the part that we're currently working on right now. Is we had a little over 200 submissions from all of the ground ambulance service organizations in Washington. So we're just cleaning up the data to make sure that it's accessible for everyone. And then once that is up, we will be posting it on our website, link to it on our website, since it'll be on data.wa.gov as the primary host for it. We have also set up an email alert system. So if you want to get notified every time the rates get updated, so we're expecting, essentially, we don't expect a lot of rates to be updated outside of the proposed window of November 1. So we'll send an update, a week or two after November 1, once the rates have been updated. But if someone were to follow the emergent financial viability issue or risk strategy, we would also send a notification to let everyone know that we've updated some rates there as well. Well, like I said, the database is not currently up yet. We hope to have it up soon, but we don't have an exact date since we are currently working through the data of over 200 submissions. So I'm just going to go over some next steps of what's going on with ground ambulance service organizations. As I mentioned, the rulemaking. So that is this. We're in the CR 102 process. The public hearing, again, November 26th. I'll go over where on the website you can find all of this information as well. We've also made some updates to our ground ambulance services and surprise billing webpage, so you can find all of this information. That is where the webinar, this webinar will be posted, as well as the slides. We hosted 2 other webinars. This one is geared towards consumers, but we did a webinar for ground ambulance service organizations and a webinar for health carriers. Those webinars will also be available, and the slides will also be available there. We've also moved our ground ambulance advisory group. Sharon mentioned the study that we did with the support of the ground ambulance advisory group. We have that on our website and all the information. You can see the full report. You can also see notes and presentations from the ground ambulance advisory group meetings. All of that is up there as well. And then, of course, once we're hoping to get this publicly accessible database launched shortly. This last page is just some resources about more information where you can find about or resources for more information about the Federal No Surprises Act, SSB 5986, rulemaking, all of that good stuff. And then this final page is just your resources for where you can go if you have questions. Policy@oic.wa.gov is a good email, but also if you've got complaints, we'll go over some of the places that you can go to find that. And that's the end of the slide deck. So I am going to bring over the website page now. And I will be putting these links in the chat, and I have made sure that it is going to everyone. So this is just our general OIC landing page. So I'll show how to link to these other pages up here. The place I like to go best right now is current issues and going to protections from surprise medical billing. And if you go there, it brings you to this page. And we've got buckets for everyone: consumers, medical providers, ground ambulance service organizations, health insurers, and self-funded groups. So for most of you, what consumers need to know is probably where you want to go. It covers everything about balance billing, all of this stuff. And then if you scroll all the way to the bottom, you get to the consumer notice. We have one that is effective until December 31, 2024. And then we have an updated consumer notice that will take effect January 1, 2025 when SSB 5986 takes effect. We also have, this is the older version in the top 10 languages, and this is the newer version in the top 12 languages. So if you're looking for the consumer notice in multiple languages, that is where you go. And then I'm going to scroll to the top. And if you're looking for information specific to ground ambulance services, you want to click ground ambulance services and surprise billing. Again, we've got some general information. This is the full report and executive summary from our ground ambulance advisory group. And then if you scroll down a little bit, that is where you can find all of this information. So about the local rate submission process and these webinars. So as you can see, we've already got the webinar for the GASOs posted. That was a few weeks ago. And we have the webinar presentation materials. You can sign up for GASO related news here. This is geared mostly towards ground ambulance service organizations. This is where we'll be sending reminders to make sure that they submit their rates. That's generally what we'll be using it for. If you are wanting to be notified about rate updates, please use the sign up for public rate updates. That is where we will send that information. You can also sign up for general OIC balance billing related news. That's at the bottom of this page. Or no, it's not. But you can always contact Policy and Legislative Affairs, which is our division. And oh, there it is, right. It's got an entirely separate link. Sign up to get surprise billing news. So that's where if you want to go for just very general information. So the next page is the implementation of SSB 5986 and updates to the Balance Billing Protection Act. This is our rulemaking page. As I've mentioned, we have not officially opened our CR 102. We have not published it yet. We are hoping to do that soon. So once that happens, it will appear here up at the top of the page. You can sign up for the public hearing, and you can see our draft of the rules, and you can see all of that other and the CR 102 filing information. It also links you to the chapters that we're working in and all of that. And so I will drop these links in the chat now. So this is the general surprise billing website page. This is the one specific to ground ambulance services. And this is the rulemaking page for ground ambulances. There we go. And then this next page is our ground ambulance advisory group. This used to be on the ground ambulance services and surprise billing page, but given the level of content and information, we've moved it into our work groups. This is where if you just want to get the history of this law and how we got here and people who were involved, you can see who was in the study. You can read the report. You can see the directive from the legislature. You can see all of the meetings that we had and the materials that were included. And then I also like to just provide the actual link to the law. So this is SSB 5986. And then this is the chapter 4849, which is where all of the balance billing protection laws are. If you're looking for specifically ground ambulance services, that would be 4849-200, 4849-205, and 4849-210. And that, I think, covers all of that. So I'm going to stop sharing now. And we are going to open up our chat and Q&A. And it looks like we've already got one question. How will the OIC be notifying opted-in group health plans about reattesting? Great question. So we are sending out an email to all of the plans that are currently opted in. We're sending it directly to the people that they listed as their contact information, letting them know that they have until December 31st, 2024 to submit their new attestation. Otherwise, we will begin unenrolling plans beginning January 1, 2025, because per RCW 4849 130, which is it, 130, we have to have them affirmatively attest to the full suite of protections. And since we now include 48 RCW 4849 200, which includes ground ambulance service organizations, we need them to attest to that. So December 31, 2024 is the deadline. We'll be sending out an email. We'll be sending out a WebGov delivery blast. We've also put it in some prominent spots on our OIC website page, and we will send some reminder emails like, hey, remember to do this. And hopefully everyone sees it, and we'll be working with as many groups as possible because we would really like to see the numbers stay at about 450 if possible. All right, that was the first question. Hopefully that answers that. So far, and I've already answered, yep, the webinar will be recorded and posted. So I don't see any other questions at this time, but we'll definitely give people a little bit longer. All right, thank you. Is there a way to update contact info of opted-in employers?
Yeah, I think if you, I would say go to the list. Sydney, do you want to bring up the list of self-funded group health plans?
Yeah,
And if there's not a way to modify right on that list, feel free just to modify it online. Feel free to send us an email at policy. It's policy@oic.wa.gov, or do we want to send people to
we're going to
Catherine?
send them. We're going to send them to Catherine. So I will put that email in there in just a second.
Okay.
So here's
Just-
the self-funded group health plan page. Let's just click on this one as an example. Yeah, it doesn't look like you can change that online from what I'm seeing.
Okay, well, we'll send people to Catherine to update.
Yep. So give me 1 second to pull up that email. And I will drop that in the chat. But thanks for being on that, because that will certainly help us, since we have a feeling that there might be a few that are out of date. All right, that is the email if you want to update that information. And we'll get you added to the list. And the attestation form is ready to go. So it takes, I think, what we heard was it took people about 5 minutes to fill it out. So it's ready to go. We set it up so that way if anyone was trying to attest now, they would not have to do it twice. It's mainly the people who have automatically opted in or renew their automatic opt-in that we are wanting to make sure we get in contact with. Thank you for adding the translations for the consumer notice. Greatly appreciated. You are very welcome. We are glad that they are helpful, and they are definitely out. So, and yeah, just making sure, I think the big thing we were wanting to make sure everyone knew was that those are supposed to be used beginning January 1, 2025. You need to use the older one up until December 31, 2024, since that's when the law becomes effective. All right, gonna give everyone a little bit longer for some questions. I know that was a lot of information to throw at you. It's been a long process, obviously, getting here, but we're happy to see it moving forward so well. Let's see. Any other? I guess while I let people think of questions, I'll stress again, participating in the rulemaking process, we do strongly encourage people to submit comments and attend the public hearing. It's a really great way to be involved and get your voice heard, and to share your thoughts. And it's, it's where we rely on a lot of information from the public. So it's great to see people get involved in that. So strongly recommend, even if you don't have a comment, bookmarking that page. We do send out updates. You can sign up for a WebGov delivery related specifically to that rule, and you can get updates when we send out the CRO 102, the CRO 103, the public hearing, all of that. So I do strongly recommend signing up for that as well. I strongly recommend signing up for all of the WebGov deliveries that we've set up if you want to stay as informed as possible, because that is our primary tool here at the Office of the Insurance Commissioner for how we communicate updates and changes in information. And it gives you the most control, so you can choose how many, how informed you want to be and how many alerts you want to get, because sometimes they do overlap. All right, still not seeing any new questions. I think I will give it, let's see, it's 11:33. We'll give it, say till 11:38 for any questions to come in. I know, again, it was a lot of information, and yes, it will be recorded. We have the Ground Ambulance Service Organizations one posted. And we did the health carriers one yesterday, and that will be posted probably around the same time as this one. All right, Robert, if someone lives near a border state and gets transferred out of state, would they be protected? So I think in this situation, you're imagining if you're living in Washington, but the nearest hospital would be in Idaho, and you get transported from like a small city, because I guess I'm thinking of Asotin. Jane, does that make sense? Like, I think the nearest hospital is across in Idaho.
Right. I think that if the transport originates in Washington and goes to Idaho, it's a Washington entity that's doing the transport. They're prohibited from balance billing. Once somebody is in Idaho, if they're transported by an Idaho ground transport entity, we can't prohibit them from balance billing because we can't regulate out-of-state providers, which is why we would like Congress to amend the No Surprises Act to add protection for ground ambulance balance billing.
Okay. Thank you, Robert, for clarifying in the Q&A too. And I believe the links, yeah, we did include in our slide deck some links about the Federal No Surprises Act. And as Jane mentioned, they formed their own advisory group and they are issuing recommendations. Those recommendations have not been formalized and sent to Congress yet. We're not sure of an exact date when those will be issued, but we are tracking them here at the OIC because we are very interested to see. We attended a lot of their panels because we were very curious about what they were going to do and how closely it would parallel what we were doing here in Washington, since we were just a tiny bit ahead. We get another question? We did. Will the OIC send notice to the health plan administrator TPA of any SI sponsors that are unenrolled from protections?
Oh, we should, definitely. We should send it if we can. We'll definitely send it to the contact information that is in the opt-in website, form that's filled out.
I think our concern is when those contacts are
outdated.
yeah.
I think what we might do is I am going to assume that when the self-funded plan attests, that just as they have currently, they're going to put in the third-party administrator. If there are people that we're disenrolling or self-funded plans that we're disenrolling, we can check and see who the third-party administrator is. And if it's an entity like a carrier that we deal with on a regular basis, we can certainly, I think, send a heads up to those carriers, to their regulatory affairs folks who we deal with on a regular basis.
Mm.
If it's a TPA that we have no relationship with, we will send the notification to whatever address is listed in the opt-in material.
That sounds good. And as stated, we're sending out the notifications for that this week to the self-funded group health plans that are currently opted in. We are using the addresses that are currently listed. And they have until December 31, 2024 before the unenrollments would start happening. So we've got plenty of time. It takes 5 minutes, so please stress that to everyone. You know, it's very quick. It's a lot of really good protections. Obviously, they thought so if they were enrolled in it in the beginning, and we want to see them maintain those protections for their consumers and employees. So strongly recommend doing that. But December 31, 2024, that's the deadline. Take away anything about the self-funded group health plans right now. December 31, 2024 is our new attestation deadline. And hopefully everyone, I put in the email. So if you have questions or anything related specifically to self-funded group health plan opt-in, that is the email address that I would recommend reaching out to. That goes directly to someone who oversees that entire spreadsheet. She's got a lot of great information. And but yeah, if there's any questions, I'll obviously be directed to us as well over here in the policy division at the Office of the Insurance Commissioner. Okay, I'm gonna give it 1 more minute. See if there are any other questions that trickle in. All right. Well, we're gonna wrap up here because I don't see any other questions coming in. So please, I put all of those links in the chat as resources. Until we get the webinar posted, that is the best place to go. Please, if you're interested in the self-funded group health plan, save that email address that I've posted as well. That would be a really good place to, like, you can go there. We also put the policy at oic.wa.gov email. That is another great place to go. But all of this information can obviously be found on the Office of the Insurance Commissioner's website. So please check that out. There's a lot of good information there, but we're always happy to help. And I think on that note, we'll wrap it up. Thank you so much, everyone, for joining us today. We hope you found this useful and informative and helpful. But if you have any questions after the webinar, please feel free to reach out to us. And thank you so much to everyone for joining us. Have a good rest of your day.